I would like now to share with you some information about the equipment that we use to take blood pressure. The first piece of equipment we have is the stethoscope. It involves the earpieces, and the earpieces should be faced toward the front of the head so that your hearing is enhanced. That's the direction the ear canals would go. And there's a long piece of tubing, and it finishes on the head. This is called a Sprague-Rappaport stethoscope. It has a pivoting head, and the head allows us to hear different frequencies. With very high frequency sounds, the sound waves are very close together, and we have a diaphragm. With lower tones, by flipping it around, it's a little more space between the outside rim and the hearing device, and with the wider sound waves, it enhances the quality. To know which side you're on, just give it a little tap, and you can tell which side is engaged. Typically, you would never want to wear one of these on the sides of your neck when you're writing. That will cut the circulation off, give you some pretty bad headaches. Normally, you would wrap this around your neck when you're carrying one. A little higher end stethoscope is the Littman Master Cardiology. Very similar in design, has the earpieces, and it has the tubing, and then it has on the bottom, you'll see it doesn't have a pivoting head, but it has more or less like a trampoline. This is called a tunable diaphragm, and by pressing a little harder, you will shorten the sound waves, and it can hear those higher pitched tones, and with a lot lighter pressure, you can hear the lower tones, all with one stethoscope. These do come with a couple of extras. They have extra earpieces that you can put on for maybe different levels of comfort depending on your own personal preferences. And we also have what they call a bell sleeve that you can actually put on the diaphragm head, and it's kind of a non-chill sleeve, so it's not touching directly against a patient that might be a little more sensitive to that. Also, with our blood pressures, we have different types of sphygmomanometers. These are our blood pressure cuffs. One thing you'll notice is, written down here, you'll have the maximum circumference. This one is made for children. It's got the little dinosaurs on it. And this would be the size that we would use. For the dial, we have this little Tyco, and you can see there's a little box down at the bottom. And if the needle is in the box, then we know that it's properly calibrated. These are calibrated and lifetime guaranteed. So if they're off calibration, you just send them to the manufacturer and they can calibrate them for you. We also have adult cuffs that we would use. And an adult cuff, again, we could have it calibrated, and we have the girth of the arm for an adult. This one says 31.5 centimeters. Sometimes you'll have larger adults. In that case, we do have larger cuffs. This one goes up to 38.4 centimeters. You'll notice the setup is just a little different. Instead of a dial, like we had on the first ones, that you can just kind of release the pressure, this has a little rocker switch where you can just kind of slowly let the pressure out and again get the blood pressure. Okay, another type you might see, and for exercise testing, we love to have these so it's all on one hand. This has got a little spoon that you can push it against, and again, we can release the pressure with one hand. Okay, if you have patients that might be sensitive to latex, we also have the latex-free type cuffs. Normally they have this orange type tubing, so you'll know if you have one of those also.